This medication is used to treat or prevent certain types of headaches, such as vascular headaches including migraine and cluster headaches. Cafergot works by narrowing widened blood vessels in the head, which can sometimes cause headache pain. Caffeine in the medication also helps to increase the absorption of ergotamine and further narrows widened blood vessels. It's important to take this medication as directed by your doctor and to not exceed the recommended dosage. It's best to take Cafergot at the first sign of a headache for the best results. When taking Cafergot, it is important to follow your doctor's instructions. Typically, you should take 2 tablets at the first sign of a headache, followed by 1 tablet every half hour until the headache is relieved. It's important not to take more than 6 tablets per headache attack or 10 tablets in a 7-day period. If your doctor has prescribed this medication to prevent certain types of headaches, take it exactly as directed, usually for short-term treatment, 2 to 3 weeks. The dosage will be based on your medical condition and how you respond to the treatment. It's best to take this medication at the first sign of the headache. Waiting until the headache has worsened may result in the medication not working as well. If you are at a higher risk for heart problems, your doctor may perform a heart exam before you start taking this medication. They may also direct you to take your first dose of this medication in the office/clinic to monitor for serious side effects, such as chest pain. Cafergot is usually taken only as needed and should not be used for long-term daily use. It's important to take this medication exactly as prescribed to lower the risk of addiction. If you find that you need to use this medication more often, or if it is not working as well, or if your headaches get worse, be sure to talk to your doctor. Some common side effects of Cafergot may include nausea, vomiting, upset stomach, restlessness, trouble sleeping, or dizziness. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, you should contact your doctor immediately if you experience any serious side effects, such as irregular heartbeat, numbness or tingling in fingers or toes, cold hands or feet, muscle pain or weakness, severe abdominal pain, lower back pain, or signs of kidney problems. In the event of very serious side effects, such as chest pain, confusion, trouble speaking, vision changes, or weakness on one side of the body, seek medical help right away. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of all possible side effects. If you notice any other effects not listed here, be sure to notify your doctor or pharmacist. Remember, in the US, you can report side effects to the FDA at 1-800-FDA-1088 or online at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. This medication, Cafergot, may rarely cause a serious decrease in blood flow to the arms/hands, feet, or brain, which could lead to a stroke. The risk of this happening is higher when Cafergot is taken with other drugs that can affect the removal of ergotamine from your body. These drugs include mifepristone, telithromycin, certain antidepressants, such as nifazodone, azole antifungals, such as ketoconazole, itraconazole, cobicistat, macrolide antibiotics, such as clarithromycin, erythromycin, troliandomycin, HIV protease inhibitors, such as nalfinavir, indinavir, ritonavir, SSRIs, such as fluoxetine, paroxetine, fluvoxamine, among others. Before taking Cafergot, it's important to let your doctor know if you have any allergies to ergotamine, caffeine, or other ergot alkaloids. This medication may also contain inactive ingredients that could cause allergic reactions, so it's best to talk to your pharmacist for more details. It's important to discuss your medical history with your doctor before using Cafergot, especially if you have any blood circulation problems, certain types of headaches, heart problems, kidney disease, liver disease, or a personal or family history of substance use disorder. Certain conditions can increase your risk for heart problems, so be sure to inform your doctor if you have high blood pressure, high cholesterol, diabetes, a family history of heart disease, or if you are overweight, postmenopausal, women, or over 40 years old, men. Cafergot may cause dizziness, and using alcohol or marijuana can increase this effect. It's important to avoid driving or using machinery until you can do so safely, and to limit alcoholic beverages. If you are using marijuana, it's best to talk to your doctor about it. Additionally, using tobacco or nicotine products while taking Cafergot can increase the risk of serious side effects, so it's important to avoid tobacco use and talk to your doctor about how to stop smoking if you currently smoke. Before undergoing surgery or certain medical procedures, it's important to inform your doctor or dentist that you are using Cafergot and to disclose all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that Cafergot must not be used during pregnancy, as it may harm an unborn baby. It's important to discuss the use of reliable forms of birth control with your doctor and to inform them if you become pregnant or suspect that you may be pregnant. This drug also passes into breast milk and may have undesirable effects on a nursing infant, so it's important to consult your doctor before breastfeeding while using Cafergot. It's important to be aware of potential drug interactions with Cafergot, as they can affect how your medications work and increase your risk for serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. If you also take triptan migraine drugs, such as sumatriptan or rizatriptan, it's important to separate your triptan dose from your Cafergot dose to lessen the chance of serious side effects. Ask your doctor how long you should wait between your doses of these drugs. Some products and beverages, like coffee, colas, and energy drinks, may contain caffeine or ingredients that could raise your heart rate or blood pressure. It's important to inform your pharmacist about all the products you are using and ask how to use them safely, especially when it comes to cough and cold products, diet aids, or other headache products. Additionally, Cafergot may interfere with certain medical and lab tests, possibly causing false test results. It's important to make sure that lab personnel and all your doctors know that you use this drug. Always follow your doctor's instructions and guidance when taking Cafergot. If someone has taken too much Cafergot and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of an overdose may include nausea, vomiting, numbness or tingling in the fingers or toes, chest pain, and muscle weakness. It is important not to share Cafergot with others. Certain foods and beverages, as well as food additives such as red wine, cheese, chocolate, and monosodium glutamate, can trigger migraine headaches. Lifestyle patterns such as irregular eating or sleeping habits, as well as stress, may also contribute to migraine attacks. Avoiding these triggers may help reduce the frequency of migraine attacks. It is best to consult with your doctor for more information on managing these triggers. The typical dosage of Cafergot is 1 to 2 tablets at the first sign of a migraine headache, with a maximum of 6 tablets in 24 hours. The medication works best when taken at the first sign of a headache. Be sure to follow your doctor's instructions on when and how to take Cafergot for the best results. Cafergot is used to treat or prevent certain types of headaches, vascular headaches including migraine and cluster headaches. It works by narrowing the blood vessels in the head, which helps to decrease the throbbing pain of migraines. This medication should be taken at the first sign of a migraine headache. The usual dose is 2 tablets at the start of the headache, followed by 1 tablet every half hour until the pain is relieved, up to a maximum of 6 tablets in any 24-hour period. Do not take more than 6 tablets for a single migraine headache or more than 10 tablets during any 7-day period. It's important to store Cafergot at room temperature, away from light and moisture, and not in the bathroom. Make sure to keep all medications out of reach of children and pets. When it comes to getting rid of unused or expired Cafergot, it's best to consult with your pharmacist or local waste disposal company for proper disposal methods. Avoid flushing the medication down the toilet or pouring it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.